So I'm an upper cervical chiropractor. An upper cervical chiropractor is very different than standard chiropractic. I don't do any twisting, cracking, popping. I make a very precise correction to this top bone in the spine, and we put it back exactly where it's supposed to go. This top bone is called the atlas. Now all the other bones in the spine look like this, and they have these bones that interlock and limit how much the spine can move. But the atlas, that top bone, is very different than all the other bones in the spine in the fact that it doesn't have those same bones that hold it into place. It's very freely moving. The only thing that holds it into place are these muscles, tendons, and ligaments. And so throughout life, we have different accidents and injuries that happen. And it doesn't have to be a major car accident or, a head-on collision type of thing. Everybody's rang their bell, everybody's seen stars. When that happens, it makes little tears in these muscles, tendons, and ligaments, which means then this bone moves out of place. When it moves out of place, it heals out of place. Now the first thing that happens is you can see that this is the skull. It takes the head with it. Now the brain has a self-righting reflex where it wants your head to go level. So it's going to level your eyes. It can't change the position of this bone, and so now we're going to start getting compensations all the way up and down the spine. We can have issues at low back, we can have issues at mid-back, neck, knees, hips, because we're trying to balance the weight of this bowling ball up on top of the spine. But the other thing that happens is that when this bone moves out of place, it puts pressure on the brainstem. Now the brain communicates to every function in the body, not only how the heart, liver, kidneys, digestive tract, everything is hardwired to that brain through nerves. It also controls fluid regulation to the brain. It also affects all of the cranial nerves in the brain. In other words, the eyes, ears, nose, throat, everything is affected at that brainstem level. So when we have interference at that brainstem level, it can literally affect any function in the body. So that's in a nutshell of what I do. I take pressure off of this brainstem so that we can start restoring normal function and normal posture to the body.